Today, we're ripping the curtain back on a medical truth that is actively being hidden from you. It's a bombshell piece of information that your primary care physician may never share, and it could be the difference between a golden retirement and a decade of avoidable medical misery. We're talking about the supposed safe routine health screenings that millions of Americans over the age of 70 line up for every single year, believing they are taking proactive steps for their well-being. But what if the very tests meant to protect you are actually setting you up for unnecessary surgery, debilitating complications, or a dangerous misdiagnosis? Stick with us until the very end, because we're exposing the 5 worst offenders, the health checkups you need to aggressively question once you hit the big 7-0. The data is clear. An alarming percentage of medical tests performed on older adults result in a downstream domino effect of invasive procedures, side effects, and life-altering treatments that were never truly needed. A staggering number of seniors are simply being over-tested, and the consequences are absolutely terrifying. One test on our list, the absolute worst offender, may actually be responsible for creating as many new cancer cases in the United States as a lifetime of heavy drinking. You won't see that headline in a medical journal's glossy magazine, but the science doesn't lie, and we're breaking it down today. Get ready to challenge everything you thought you knew about preventative care. Before we dive in, do us a favor, hit that like button, subscribe to Senior Secrets Health 365, and tell us in the comments below where you're watching from and what your age is. Have you ever felt pressured into a test or procedure that you later regretted? Let us know. Your stories help all of us make better health decisions. Now let's get started with a test that seems completely harmless, yet can quietly steal your peace of mind and land you on unnecessary medication. The idea behind the bone density scan is great. A simple, non-invasive way to check for osteoporosis, giving you an early warning against severe fractures. But here's the reality for many adults past their 70th birthday. This quick scan, technically known as a DEXA, can turn a normal sign of aging into a panic-driven medical problem. It measures your bone mineral density, and for most older individuals, especially women, the result will show some degree of lower density, what doctors call osteopenia. Listen, a slight loss of bone density is as common and natural as getting reading glasses or finding a few new gray hairs. It's just a part of the aging process. However, once that number is on the screen, countless seniors are immediately pressured into starting powerful prescription drugs such as bisphosphonates. These are medications meant to fortify the bones, but they carry incredibly harsh risks, including irritation of the esophagus and a rare but serious condition called osteonecrosis of the jaw, which means the jawbone can actually start to decay. And here's the kicker. Studies following seniors over the age of 70 who have mild bone loss show that treating them with these potent drugs barely makes a difference in their actual risk of breaking a bone. We're talking about a negligible reduction in fracture rates over 5 years. Is that tiny fraction worth the risk of a dying jawbone or severe digestive issues? Let me tell you about Mildred, a 77-year-old retired school administrator in Dallas. She was active, walked her dog daily, and had never had a fall. Yet her annual physical led to a DEXA scan, which showed osteopenia. Her physician immediately put her on a bone-building pill. Within 4 months, Mildred had constant burning heartburn and couldn't eat without discomfort. We had to take her off the medication and focus on a common-sense approach: plenty of vitamin D, a diet rich in calcium-heavy foods like salmon and collard greens, and targeted weight-bearing exercises using light resistance bands. A year later, she was stable, medication-free, and felt stronger than before. For older adults who are not prone to falling or have no prior fractures, the best medicine is lifestyle, not a prescription. Strength training and better balance can drop your fracture risk far more effectively than some of these chemical treatments. Don't let a number on a printout push you into a treatment you don't need. When a senior starts misplacing their keys more often, or struggling to recall a distant name, the immediate reaction is fear, the terrifying specter of dementia or Alzheimer's. In response, many medical professionals order a brain MRI. But hold on, because the truth about these detailed brain images is profoundly unsettling. An MRI, which captures the structure of the brain, almost never provides the clear answer a patient is hoping for. For nearly all adults over 70, the scan will reveal minor, age-appropriate changes, a bit of white matter damage, or slight overall shrinkage. These findings are often entirely normal and expected. The danger, though, is what happens next. The moment those minor, vague spots are seen on a report, they can initiate a medical panic attack, leading to a relentless pursuit of diagnosis. This can spiral into more invasive procedures, including spinal taps or even risky exploratory brain biopsies that will not help memory and can certainly introduce new complications. Data reviewed from major institutions reveals that in older patients with only mild memory complaints, the vast majority of abnormal findings on an MRI are not linked to anything treatable. That means over 90% of people who get this scan have the emotional trauma of being told there's something wrong when in fact there's only normal wear and tear. Consider Frank, a 75-year-old retired attorney in Phoenix. He was slightly forgetful, but his thinking was otherwise sharp. His doctor sent him for an MRI, which showed those common white matter changes. Frank became convinced he was descending into Alzheimer's, stopped driving, and became withdrawn. His anxiety dramatically worsened his cognitive function. When a simple, inexpensive pencil and paper cognitive test showed his function was completely normal for his age, we shifted the focus away from the frightening scan. We emphasized better sleep, better hydration, and brain-stimulating hobbies. In 3 months, his anxiety dropped and his memory bounced back. Unless a senior is experiencing severe, sudden, or rapidly escalating neurological symptoms, such as seizures or a fast decline in their ability to perform daily tasks, a simple, inexpensive cognitive screening test is a far superior, safer, and cheaper starting point. Don't let an ambiguous image in a high-tech machine scare you into a medical path you don't need to take.
If you're over 70 and complain about just feeling a bit more fatigued or slightly winded climbing a flight of stairs, the cardiac stress test is one of the most common referrals you'll receive. This test forces your heart to work hard, either by having you walk on a treadmill or through chemical stimulation, all to check for blocked arteries. Yet for an asymptomatic older adult, this test is rife with danger because it's prone to false alarms that drag people into the operating room. For the over 70 population, the rate of false positives, where the test incorrectly suggests a serious heart issue is present, can soar up to 40%. This false flag leads directly to more invasive follow-up tests, like an angiogram, where a tube is threaded through your arteries, and tragically often results in entirely unnecessary procedures like stent placements or bypass surgery. Research from top medical journals found that more than half of all stenting procedures performed after a stress test referral were given to patients who did not benefit at all in terms of survival or quality of life. What these patients did get was an elevated risk of bleeding, kidney injury from the contrast dyes, and lengthy hospital stays. Take the case of Robert, a 78-year-old man from Chicago who had always enjoyed long walks. He mentioned to his doctor that a steeper hill now made him a little tired. A stress test was ordered, and the results were inconclusive. The next step, a catheterization, where a mild, non-critical narrowing was found and a stent was immediately placed. That night, Robert had a severe allergic reaction to the dye, leading to a week in the hospital with acute kidney distress. His fatigue never went away because it wasn't a heart issue. It was just an older body needing a little more rest. If you aren't experiencing clear classic symptoms of heart disease, like chest pain during activity or shortness of breath on mild mild exertion, a resting EKG or a non-invasive coronary calcium scan is a vastly safer and more sensible way to assess risk, avoiding the express lane to an operating table. This test is perhaps the most heavily promoted and, ironically, the most dangerous screening on our list for men over 70. The PSA test measures a protein in the blood that can be elevated due to prostate cancer. However, as men age, this protein naturally increases due to the simple, common, and benign enlargement of the prostate, BPH. The test is incredibly sensitive, but not at all specific. The result? A stunningly high rate of false alarms. For seniors, an elevated PSA level usually leads to a prostate biopsy, which is an invasive procedure that carries risks of serious infection and bleeding. Worse, the PSA test almost always finds slow-growing, indolent prostate cancers that would never cause harm or death in an older man's lifetime. The National Cancer Institute and major medical task forces now overwhelmingly recommend against routine PSA testing for men over 70, precisely because the risk of unnecessary diagnosis and subsequent treatment, including radiation and surgery that lead to incontinence and erectile dysfunction, far outweighs any potential survival benefit. For a 75-year-old man, aggressively treating this low-risk, slow-moving cancer is often a far greater threat to his quality of life than the disease itself. If you are past 70, discuss with your doctor whether you can safely stop this test entirely, especially if you have an underlying chronic illness. This final test is the absolute worst offender, the one responsible for creating unnecessary cancer cases and procedures. The low-dose CT lung scan is primarily recommended for current or heavy former smokers. While it can catch aggressive lung cancer early, the overall application for older adults is a medical catastrophe. The danger lies in what are called incidentalomas, small, non-cancerous nodules, scars, and irregularities that are incredibly common in the lungs of anyone over 70. The LDCT scan is so detailed that it picks up these benign spots, leading to a cascade of follow-up tests, including repeat CT scans, piling on radiation exposure, invasive biopsies with a needle through the chest wall, and, in a tragic number of cases, unnecessary lung surgery to remove a harmless nodule. The accumulated radiation exposure from years of these routine follow-up scans and procedures is the silent killer. Scientific analysis has concluded that for every cancer case an LDCT scan prevents, it leads to between 3 and 10 cases of unnecessary, potentially life-shortening surgeries or procedures. It's the cumulative exposure to low-dose radiation from repeated scans and the diagnostic pursuit of benign findings that becomes the real threat. This test's overapplication is the ticking bomb of modern medicine for seniors. Instead of blindly agreeing, ask your physician, are my smoking history and health profile truly severe enough to warrant the risk of this radiation and the high chance of an unnecessary invasive procedure? You probably thought the colonoscopy was the gold standard of necessary screenings, but once you pass the age of 70, and especially after 75, its benefit plummets while the risks skyrocket. The procedure, which involves a camera checking your entire colon, is physically harsh. The prep alone, powerful laxatives, can cause severe dehydration, dangerous electrolyte imbalances, dizziness, and serious kidney stress in an older body. The sedation required also carries an added non-trivial risk to the brain function of elderly patients. And yes, the test itself can cause major problems like internal bleeding, a tear in the bowel, or heart rhythm disturbances during the procedure.
A comprehensive review of over 1 million senior patients on Medicare found a stark picture. For every 1,000 colonoscopies performed on patients over 75, the number of lives saved was minimal, yet the number of people who suffered a serious complication was exponentially higher. This is a devastating risk-to-benefit ratio. Even when a small polyp is found, removing it in a very elderly patient can sometimes be more dangerous than simply monitoring it, as many are small, slow-growing, and will never cause a problem. Let's look at Eleanor, a 74-year-old from Miami who managed a busy art gallery. She had 0 symptoms, no family history, and had 2 prior clean colonoscopies. Yet, her new physician insisted she needed another one for screening purposes. Eleanor agreed. During the procedure, a small, insignificant polyp was removed. That evening, she collapsed at home. She had suffered a bowel perforation, a tear, and required 9 days in the hospital for recovery, major weight loss, and months of rehabilitation. Her health has never fully recovered from a procedure she had no medical need for. The key guidance from top medical advisory groups is to generally discontinue routine screening at age 75 for most people. A safer, non-invasive alternative is the FIT test, a simple at-home stool test that effectively catches most concerning cases without any harsh prep or sedation. Always ask your doctor about safer options before you get locked into the colonoscopy cycle. Now, for the single most overused, dangerous, and utterly pointless health checkup for seniors, the annual full-body CT scan. These are often sold in expensive executive health packages at private clinics, promising to catch cancer early. This is a complete marketing myth. Here is the terrifying truth. These scans hit your body with a massive dose of ionizing radiation, the equivalent of hundreds of chest X-rays. And there is 0 medical evidence they save the lives of asymptomatic people. In fact, a recent major study found that the rampant rise in the use of CT scans across the country may now be responsible for generating as many as 5% of all new cancer cases in the US. The very test meant to prevent cancer is now a significant cause of it. Why is it so dangerous for older adults? Because the high-resolution imaging detects every single harmless cyst, calcification, or tiny nodule that is simply part of having an older body. The moment these incidental findings appear, a panic chain reaction begins. The patient is flagged, leading to repeat scans, specialist referrals, invasive biopsies, and sometimes entirely unnecessary surgeries. Think of Henry, an incredibly healthy, active 82-year-old in New York who taught Tai Chi. He signed up for an elite preventative screening. His full-body CT scan showed a tiny, insignificant nodule in his lung. This led to a referral to an oncologist, a PET scan, and eventually a needle biopsy. The result? Benign. The consequence? The biopsy collapsed part of his lung, leading to an emergency hospital admission and a grueling 3-month recovery for a non-issue that could have been completely ignored. Top radiologists are crystal clear. Full-body CT scans should never be used for general screening in healthy adults without symptoms. Targeted imaging makes sense if you have symptoms like coughing up blood or unexplained weight loss. But randomly scanning your entire body is like throwing a dart in the dark. The damage from the search is often worse than the thing you were trying to find. Modern medicine is a miracle, but it's not without its flaws. Sometimes the most powerful prescription is to simply pause and ask, what happens next if this test finds something? If the next step is unclear, if the treatment risk is high, or if the procedure's benefit is marginal, it may be time to confidently decline. Real health prevention is not about panic-driven screening. It's about choosing your battles wisely. Maintain a balanced lifestyle, stay active, nourish your body, and always maintain an active, questioning relationship with your health providers. Now, we want to hear from you. Have you or a loved one been through a cascade of unnecessary tests or treatments? What was the outcome? Share your perspective and experiences in the comments below. We're reading and responding to your valuable insights. Would you like me to research the safest, non-invasive alternatives for cancer screening that are recommended for seniors over 75?